today's topic is the history of research in behavioral health. Some people might ask, why are we dedicating an entire segment to history in a series that's supposed to focus on ethics? Well, the short answer is that history has taught us the need for ethics and for ethical oversight. Researchers often complain about institutional review boards and the burden that regulations place on them. And indeed, our oversight system should be friendly and efficient and effective, and sometimes we fall short of this. But if we want researchers to comply, if we want them to understand why the regulations exist and to go beyond the regulations in offering ethical protections and showing respect for participants, then they need to know why these regulations exist. It's also important to understand that the history of human participant research did not end with Tuskegee. It did not end with the Belmont Report, but it continues to be written on a daily basis. And our interviews with mental health consumers as participants in research really emphasize this point.
I think it's very critical to remember, though, that this history is really written by the scientist and doesn't truly capture the experience of human subjects. And I think that's why the early reforms were very paternalistic, because they really viewed research participants, particularly people in behavioral health that suffer from mental illness or substance abuse, as hopeless, helpless individuals that don't have much to bring to research, as collaborators providing their insight and being partners in the research enterprise.
Gene, that's an excellent point. It's also an excellent segue to our first interview. Dr. Korn is a professor of psychology at St. Louis University who's best known for his book, Illusions of Reality, which documents the history of deception in psychological research. We began our discussion by discussing the earliest days of research, which was often very unscientific. It involved the use of hypnosis or alternative living conditions. But in the early 20th century, research became far riskier. It involved procedures like lobotomies or electroconvulsive shock therapy. And it was often done without the consent of participants. Today, we would say that such research is simply unethical and inhumane. So I asked Dr. Korn, what made researchers feel justified in conducting such research? His reply was that researchers were looking for great and desperate cures to disorders that were causing tremendous suffering in the lives of individuals. And again, today we would look at that justification and say that's incredibly paternalistic. We would not conduct research without the informed consent of participants. So I asked Dr. Korn, what led to this ethical paradigm shift?
I like to at least think about the challenge that was faced by individuals who were trying to deal with these terrible problems of treating and helping individuals with mental illness. There's a book by Elliot Wallenstein called Great and Desperate Cures, which I think illustrates the kind of thing that was going on. There were situations, these illnesses were terrible illnesses, and individuals realized that and wanted to try to do something about it, and they came up with desperate cures, extreme measures. The book is a history of lobotomy and shock treatment. And Wallenstein talks about how in the middle part of the 20th century, these things were seen as perhaps great hopes for curing. In fact, Igaz Moniz, a Portuguese physician, won the Nobel Prize in medicine for his development of lobotomy. Of course, as time went on, it was clear that many of the individuals using these techniques were less than admirable, and certainly ethical issues then were raised about that.
Some ethicists would say that looking back on the history that you described, that physicians were really focused primarily on beneficence, on trying to find cures for disorders. Medicine today is a bit different, really. People are more focused on respecting patients' wishes, trying to get inside their heads, understand their values, and obtain informed consent. What has led to this paradigm shift?
Probably the main event that led to that shift was the trial of the Nazi doctors, which led to the Nuremberg Code in 1948. The first sentence of that code is that the voluntary consent of the participant is absolutely essential, no question about that. That trial of the Nazi doctors is one in which they revealed the so-called experiments that they were doing on the prisoners in the camps. They were doing things like testing the effectiveness of X-rays as a method of sterilization, trying to find efficient methods of killing, for example, using phenol injections. And they used not only individuals in the camps, but they also used other individuals. They used, for example, thousands of schizophrenics and other people who had mental illness to also test whether or not X-rays would be an efficient method of sterilization. Yeah, this case of the experiments done by the Nazi doctors, this is another example, a very extreme example of individuals with great power using other individuals with no power in their research. The Nazis, in fact, referred to these individuals as people who had lives that weren't worth living.
Sometimes it's easier to see flaws in another culture than it is to see the flaws in one's own, and yet the history of human subjects research in the U.S. has also had its darker moments, hasn't it?
It certainly has. There are examples of experiments in which individuals were injected with dysentery, malaria virus, influenza, and then to study the effects of vaccines on these diseases. And so the individuals were subjected to having the disease, and some of them were given a vaccine, but some were in a control group and didn't get anything. The individuals used in these experiments were orphans, people in institutions for the retarded, and in one case, young offenders in an institution in Philadelphia. Again, individuals with very little or no power being manipulated by those who did have power. Now, the examples that I just gave all took place during World War II. The justification for the studies was that they were making their contribution to the war, just as our soldiers on the front lines were, and perhaps they were undergoing less stress than those soldiers. There's another case that's very important. In 1966, Henry Beecher wrote an article in which he reviewed the studies that I've just talked about. And he included in that a study that became particularly important in this history of ethics. And this is one in which children at the Willowbrook State School for the Retarded in New York were injected with hepatitis. And besides that being something that is an ethical issue to do that to the children, there were a couple of other issues in this study that makes it important. One had to do with the obtaining of parental consent. They did get parental consent, but under some pressure. In other words, the parents very much wanted to have their children admitted to the institution, and so felt pressured to take part in the study. In fact, eventually participation became a requirement for admission to Willowbrook. The other part of it was that the study had been approved by 2 different boards. And that approval led to, eventually, to federal concern with the kind of review that's done of research and to some guidelines that became known as the Yellow Book.
In the 60s, there were a couple of articles that really raised awareness of different ethical issues. Henry Beecher's article, Ethics in Clinical Research, reviewing abuses in the medical literature, Diana Baumrin's articles discussing Milgram's obedience studies. These raised awareness, perhaps, but they weren't watershed events. What specifically led to the creation of our current public oversight system and our regulations?
Well, there certainly was one critical study and reaction to that study that was most important. And that was the Tuskegee Syphilis Experiment, which began in 1932. This study used 400 African American men in rural Alabama. It was conducted by the Public Health Service, and the Public Health Service simply wanted to find out what would happen if you left syphilis untreated. There was a treatment at the time. There was a chemical treatment, but the effectiveness of it wasn't known, and there were some very uncomfortable side effects from that treatment. That wasn't the point of the study, to test that chemical treatment. It was just to see what happens if you left the disease to take its course. They didn't tell the men that they had syphilis. They told them that they had bad blood. Bad Blood is the title of an excellent book on this study by James Jones. The men were given some incentives to take part. They were given $25, which was a substantial amount of money at that time for these men. And they were also given burial insurance, which was a very important benefit because that meant the burden of the expense of burial eventually would be taken from their families. So the study proceeded, and then in the 1940s, penicillin became available as a cure for syphilis. So you might think that the Public Health Service would make that available to these men, but they didn't, because of course that would disrupt the study. Instead, they let the study continue with the syphilis being untreated. The major finding from the study was that when you left the disease untreated, the men were more likely to get sick and they were more likely to die. That's the main result of that study. There's a long-term effect, too, of the Tuskegee study, which is that the African American community now has lost trust in general in medical researchers and probably in behavioral health researchers as well.
What was the response of the U.S. government to public outcry over the Tuskegee syphilis trial?
Well, of course, there were hearings in the Congress of the United States, and they turned out to be productive in that the National Research Act was passed in 1974. And there are a couple of parts of that act, I think, that are very important. One part is that it did include federal regulations that governed human participants in research. These were modeled somewhat after this yellow book of guidelines that we referred to earlier. So we had some laws now that would protect participants. Another part of that act was the establishment of the National Commission for the Protection of Human Participants in Research. And that commission published eventually a number of reports, 10 reports, the best known of which is the Belmont Report.
And of course, the Belmont Report provided researchers with some overarching principles to govern research, like respect for persons, beneficence, and justice. Additionally, we do have this IRB oversight system now in place that builds on the regulations you mentioned. And we have a whole new set of regulations, requirements for research education of everyone receiving funding from the National Institute of Health. We have HIPAA privacy rules now, and the FDA has a whole host of regulations covering the development of pharmaceutical treatments, for example. But here's the big question. This oversight system that we've created, this regulatory approach, do you think it has been successful in achieving the aims of increasing protections for human participants in research and increasing respect shown to them?
I think it has, but you can take two perspectives on that, that of the researcher and the participant. From the researcher's perspective, I think many researchers, certainly not all, but many feel that the regulations have inhibited their creativity so that they can't do the kinds of experiments in realistic situations that were done in the 60s and 70s. Also, I think some researchers feel the IRBs have exceeded their power, that they're doing much more than is necessary simply to protect human participants. From the participants' perspective, I think the situation is much better than it was years ago, in that in the area of informed consent, individuals now have to be told anything that a reasonable person would want to know in order to decide whether or not to participate. So the information has to be complete and it has to be clear. That is, it has to be in language that the participant can understand. Also in areas where the research might be sensitive, where persons are disclosing things about themselves, there's more protection on the confidentiality of the data.
Jim, looking back on the history of the treatment of human participants in behavioral health research, what lessons do you think we can learn?
There's two lessons that I would like to mention. One concerns the real need to have regulations and committees in place to support and protect the participants in research. You have examples that we've looked at today of extreme cases of misuse of the power of the researcher and mistreatment of individuals in research. And although these aren't frequent examples, we need to maintain the protection of the research participant. The second lesson has to do with the development of trust between the participant and the researcher. If you think you're going to be deceived in an experiment, then it becomes a game, and that's a different kind of situation. If you think that you and other members of your community are being used by the experimenter, then the trust won't be there. You probably won't participate. Nobody wants to be a guinea pig. That's an animal, and you don't want to be treated like an animal. So I think the lesson is that we need to involve participants in our research, both in the design of the research, in deciding on the procedures for carrying it out, and eventually in the interpretation of the results. And if so, maybe we can build that trust.
The early history of behavioral health research has two stories to tell, and both must be given voice. One is the story of the scientist with the power, the hubris, and the vision to explore human psychology for the betterment of mankind and personal glory. But the other untold story is of the disempowered, the lost, the rejected, the psychotic, the dysfunctional, who are abandoned to the streets and to the institutions. Their skulls were cut and sawed, and their brains split in half by neuroscientists. None of their work was constrained. And then the ink wasn't even dry on the Nuremberg Code when Paul Hoch, who was director of the New York State Psychiatric Institute, began using LSD and mescaline to induce delusions and hallucinations in order to develop a model of psychosis. He also used electroshock and lobotomy to see if he could block these drug-induced psychoses. And at an APA convention in 1950, he told a packed audience about how intensely research participants suffered in these experiments, but went on to justify this as establishing psychiatry as a fact-finding discipline. This research was halted in the 1960s because psychedelics became illegal and NIMH discontinued funding. But symptom exacerbation experiments, or what is sometimes called challenge studies, became an accepted practice over the next 40 years using sleep deprivation, sensory isolation, and the use of other drugs like L-dopamine and ketamine. In fact, L-dopamine in experiments was administered to people that were undergoing their first psychotic break as they came into emergency rooms. And others were administered this drug when they were just ready to be discharged and had basically recovered. Their symptoms were then induced again, and some people, even after the experiment, went on to suffer psychosis for over a year. There was criticism of these protocols most recently, basically claiming that participants have a right to volunteer and to take risk, and it's stigmatizing to say that they can't make these decisions.
So Jean, part of your point's not primarily that participants should not be allowed to undertake risks, but that the risks were not fully explained. There was no effort really to minimize the risks.
Oh, it's worse than that. They were actually misled. They were told that there would be minimal side effects, that at the doses these experiments were safe, and that they may suffer a rise in blood pressure or that they could get a stomach ache. But the side effects, the really dangerous side effects, were never explained. And I think it's no wonder that people over the years have had mistrust of the motives of scientists, and people with mental illness have little faith in drug research, for example. I think it's important to listen to the voices of the research participants that had a discussion about past abuses. Have any of you ever heard of abuses in the past, historically, where people have been hurt by research, if you think about the past?
Yeah, me and my friends were just talking about that movie where the black man had that syphilis, the army was studying it.
Tuskegee Project.
Oh man, that's terrible.
Did someone tell me about Tuskegee? What happened?
It was a research where they inflict 100 men or so with syphilis.
Yeah, 100 black men.
And they wanted to see the effects, and they didn't tell them they had it. And I think they supposed to had, use some placebo, whatever they call that, they act like they were treating them too, and it was just terrible, terrible movie.
I mean, for
It
them,
was a governmental funded project that went on for 40 years and then started to the early 70s, and a multitude of men died because of that. They were actually guinea pigs for syphilis.
They didn't give them syphilis.
Yes, they did.
We'll have an argument.
Once they did, what happened then?
They didn't treat it. The men got the syphilis on their own.
No, listen to what I said. I said to inject you with the AIDS virus to experiment on a new drug. They had this poster down at the Hosea house on the bulletin board looking for healthy males to be injected with the AIDS virus for a vaccine of this new drug that's coming out to counteract the AIDS virus.
I think that would be illegal.
How many other people here, do you think maybe he didn't get all the details right?
no, I think they get all the process. But the whole thing is,
Healthy males and healthy males and people.
That's the only way they're gonna have a
people that's
research they
already
gotta be
infected
injected
with
with.
AIDS viruses.
So from what I've heard here, I would think you wouldn't trust researchers.
Right.
Well,
Some
how many
especially
people?
when you talk about dealing with your life,
Gene, I think some of our viewers may look at the discussion group segment and say that some of our participants really misunderstood the nature of the studies that they were talking about, but that really misses the key point. I think there are two lessons to be learned here. One, we need to do a better job in obtaining informed consent and in recruiting participants so that they understand what is and what is not being done. And secondly, and perhaps most importantly, the fact that they were willing to believe that people today were being injected with a live HIV virus.
That really impressed me.
That speaks volumes, and that speaks of mistrust of the research community.
And I think that because the spotlight in recent years has been on research violations in the media and in government, and there have been several deaths that have been in the news, that people, again, are much more concerned. In fact, there's been the suspension of some prestigious research programs because of these violations, and also there's been a movement toward accreditation of human subject protection programs. Unfortunately, in behavioral health, the violations are much more subtle and largely go unrecognized. I think it's important to go back to our discussion group members and have them talk about their personal experiences in research. How many people here thought that while they were in the research project, it was a positive experience?
Yeah, it was.
How about anyone think it was have a negative experience? How about some positive and some negative?
primarily positive. I said I was honest and forthright, and I just detect a note of, like a critical look, And I said, you did want me to be honest, But that's the only thing, the only negative that I ever experienced in any program I was in.
Did you feel judged?
For a second, I did.
I had a negative experience because I went through a research study while I was in the Department of Corrections. And I wasn't able to be forthcoming with information because I felt as though it can either harm me during my incarceration of some sort, and also I didn't want them to actually cut off my medication I was getting. See, at the point when you're in the Department of Corrections, more so like what you were saying, like being in a homeless shelter in the wintertime, they have total control over. So if they decided they wanted to cut me off because of something I said, then I would suffer in the long run because of that. Not only am I being incarcerated for the crime I committed, but now you're going to, punish me by taking me off my medication. So I was concerned.
So
about
if you
that.
left the research project, then you wouldn't get the medication?
Well, it wasn't even a choice of leaving because once you're in, I just can't get up and walk away. Some restricted movement, first of all. Even though I did volunteer for it, and I don't even know if it really was being able to volunteer totally because I was told this is what you have to do. So really, I really didn't even volunteer, come to think of it. But it was what was necessary in order to continue to get my medication. I was being evaluated to see if my medication was still necessary.
The doctor also called me a guinea pig, but I ain't really, it ain't really no big deal. But I tried to commit suicide while I was on this research, but it was medically related.
Was that because of something that happened in the research project?
No, it was because the medicine, which they claimed was FDA approved, wasn't exactly tested.
When you agreed to participate in this research, did they warn you that there could be side effects, that you were taking certain risks?
Yes.
They did? Did they mention suicide as a risk?
I don't quite remember, which, in all aspects, what I'm saying, in all due respect, I could, there ain't no say to what medicine or medication might make a person do, so, it ain't like I'm holding a grudge or something like that.
On May 16, 1997, President Clinton apologized to the last surviving participants in the Tuskegee experiments, to their families, to the African American community, and to the nation as a whole for the loss, for the years of hurt.
Well, Jean, an apology is really not sufficient to restore trust, though, is it? Has the government really gone beyond apologizing?
Well, I would agree that after all those horrors that we've talked about, it isn't. But in fact, this symbolic gesture ushered in what I believe is a new age of human subject protections. Following that apology, they convened a group in the CDC in Atlanta, Georgia. They brought together people with psychiatric problems, people of color, Native Americans, people with substance abuse problems, and experts and scientists to begin to discuss how to build trust in science and to move science forward as a collaboration between participants and between scientists. Subsequent to that, the mental health consumers came together in Portland, Oregon in 1999 to develop a platform on human subject protection and how consumers could be included in research. Finally, the suicide of a young man in California due to a drug washout in a drug trial mobilized family members to begin to be involved in human subject protections as well. And I think that all of these actions have really brought together the whole community of research, the participants, the scientists, in all aspects of research. And this collaboration has really begun to move us forward.
Well, in a sense, Jean, our own project right here, this course, is also a sign of goodwill and commitment, especially when you consider that we're conducting this with funding from the National Institute of Health. Jean, it's time to wrap up our segment, and I'd like to conclude this with a final excerpt from our discussion group, because the gentleman we're about to show summarizes the main lesson to be learned better than I could.
Don't do anything to harm the people.
Right. She just said it so simply, and that's what I was going to say, ma'am, is that because one thing that binds us all together, the researcher and the researchee, is that the researcher is a human being and the researchee is a human being. And if the researcher would not want something that was annihilating done to them, I don't think that they should do it to the researchee.
That sounds like the golden rule.
You know it, don't you? And I think that sometimes just that touch of humanity, along with what they're doing can go a long, long way. And I would like for you to let all the researchers know, show a little love to the researchees.
Well, I'll go along with that.